Our final speaker of AMO 2022 is the Honourable Sylvia Jones, Deputy Premier and Minister of Health.
Well, good morning, everyone. I have to say bless you. Third day, final speaker, and you're here. I'll try to make it worth your while. To begin with, I'd like to thank Ontario Municipalities and AMO for your advocacy, your leadership, and the work you do on the ground every single day in your communities to support local health care. You have been a critically important part of Ontario's pandemic response, and the province has noticed and is appreciative. Alongside my parliamentary assistants, Robin Martin and Don Gallagher-Murphy, I've appreciated the opportunity this week to share with you an update on some of the many things we're doing to improve the health patients that the care patients receive in Ontario, and to hear your programs and innovations that you've been doing in your communities. In particular, I want to highlight the exceptional collaboration that we've seen across the healthcare system throughout the pandemic. The many healthcare partners who provide patient care have been working together in new ways so that Ontarians have access to the care they need throughout the pandemic. Faced with enormous challenges as a result of the pandemic, we've seen how communities have come together to fight COVID-19 and support your residents. Premier Ford and our government is so grateful for the extraordinary efforts of the province's healthcare workers, the paramedics, the nurses, the public health workers, the doctors, personal support workers, and so many more, who have shown incredible perseverance, dedication, and sacrifice to provide exceptional care to Ontarians. Thanks to the efforts of so many people and organizations, as well as Ontario's cautious and phased approach to reopening, Ontario has fared better than most other jurisdictions around the world. We have one of the highest vaccination rates worldwide, which has been critical to stopping the spread and reducing severe outcomes. Because of this vaccination coverage, our pandemic surveillance shows the recent uptick of COVID-19 is, in fact, plateauing. Our government will continue to work with municipalities, public health units, community organizations, and other sector partners to ensure we have the necessary tools to manage the impact of the virus over the long term. This includes continuing to support the health system rebuild and recover. In March of 2022, we launched our first Plan to Stay Open, a plan that is filling long-standing gaps in three main areas, including expanding the province's health workforce, shoring up domestic production of critical supplies, and opening more hospital beds. Our goal is to provide people and businesses with more certainty by helping to keep Ontario open. This plan is adding 5,000 new and upscaled nurses and 8,000 more personal support workers to Ontario's workforce, adding to the nearly 1,100 healthcare workers Ontario has added since the start of the pandemic. 1,100. It's provided Ontario nurses with a $5,000 retention bonus and gave our personal support workers a hard-earned permanent raise. Our Plan to Stay Open removed Canadian work experience requirements, bringing online over 1,200 internationally educated nurses who are now working in hospitals and long-term care homes in our community. Since then, I have met with and directed regulatory colleges to expedite their application approvals so that more internationally trained healthcare workers can be registered to practice as quickly as possible. I expect to receive those plans from both the College of Nurses and the College of Physicians and Surgeons of Ontario this week. Working with the Minister of Colleges and Universities, Jill Dunlop, we've launched the new Learn and Stay grant which pays the full cost of tuition and supplies for in-demand professions, starting with up to 1,500 nurses this year and growing to 2,500 students in exchange for agreeing to serve in underserved communities. The plan is creating 160 undergraduate and 295 new postgraduate positions on top of the historic work to build 2 brand new medical schools in Brampton and Scarborough, the first new medical schools to be established in decades in Ontario. We've also expanded the summer physician locum program, which helps our northern and rural communities address staffing shortages over the summer months. Altogether, these measures equal the largest expansion of physician training in over 10 years. The plan to stay open is investing billions, the most in our province's history, in hospital and healthcare infrastructure, supporting 50 new capital projects in your communities that will create over 3,000 new beds. That is the equivalent of 25 mid-sized hospitals. That's on top of the 3,500 net new beds our government has added since the start of the pandemic. We also know there is a need to create more capacity and address long-standing bed shortages in our hospitals to ensure Ontario is never again left with our hospital capacity at such vulnerable levels. That's why we have provided a 4% operating funding increase to the hospital sector, including an increase to every public hospital's base operating budget, supporting the continuation of over 3,500 new and permanent critical care, acute and post-acute beds created during the height of the pandemic. In order to tackle the surgical backlog in the province, we're helping fund more scheduled surgeries, procedures, and diagnostic imaging services through a $300 million investment in Ontario's surgical recovery strategy. This strategy is already proving to be a success, with diagnostic imaging backlogs basically having been eliminated. With fall a few short weeks away, we know we need to continue working together with our partners in order to address the current pressures on our health system, surgical backlogs, and the expected upcoming winter surge. Which is why this week we will unveil the next phase of our plan to stay reopen, aimed at health system stability and recovery. Our goals are clear. Provide the best care possible to patients and residents while ensuring the resources and supports are in place to keep our province and our economy open. While we'll have more details later this week, I want to talk to you about one area in this plan that I know will be of particular interest to municipal leaders. In collaboration with health partners and municipalities, new 911 models of care initiatives have been established in over 40 municipalities. Many of you shared those plans with me in our meetings. For those who haven't heard of them, these successful innovative projects allow people, including palliative care patients and those experiencing mental health and addictions challenges, the option of receiving more appropriate care at home or in community, avoiding a visit to the emergency department. These initiatives are helping to ensure that more people can get the kind of care they want and need in community. Initial results of these 40 projects show patients are accessing care 17 times quicker, and 94% didn't go to the emergency department in the days following. Thank you. It is clear that the 911 Models of Care program is working, and I've heard loud and clear from you that these kinds of innovative solutions are what your communities want and deserve. That's why I'm pleased to announce that we are moving forward with expanding these 911 models of care to more municipalities. And at the same time, we are expanding the ability of when paramedics can safely and effectively provide treatment, starting with minor acute treatments and injuries such as falls and managed chronic conditions such as diabetes and epilepsy. The 911 Models of Care initiative builds on the effective community paramedicine programs that already deliver a range of services in communities across the province to help improve access to care and help people with chronic conditions live independently at home with support. I look forward to exploring more ways we can work together to further support community paramedicine and other innovations that will reduce 911 emergency calls and emergency department visits to preserve hospital capacity and provide an improved patient-centered experience. To preserve our hospital capacity and help people get the most appropriate care they want and need, we are also investing more in innovative programs that give patients more options to receive care outside of the traditional hospital setting. Our government is investing an additional $1 billion over 3 years to expand home care to thousands of more patients so that they can get the care they need in their homes and in their communities. We're providing additional funding for community support services, such as adult day programs, meal services, transportation, assisted living services, and caregiver supports within our own community. To help relieve pressure on the ambulance system, we have increased annual funding for the dedicated offload nursing program and increased eligibility so that more healthcare professionals can assist with offloading ambulance patients in emergency departments, and paramedics can respond to their next emergency call sooner. The Ministry also provided northern municipalities with additional funding to build up medical transportation services to transport medically stable patients as an alternative to using ambulances. For example, this year we are providing nearly $764 million to assist municipalities with the cost of land ambulance operations, an average increase of 5%. This also, of course, includes critical ambulance services delivered by Orange, which are fully funded by our government. The province will continue to meet regularly with the chiefs of the paramedic services in your municipalities to address current challenges, including ambulance offload delay and paramedic training and certification, hiring, and retention. I'll change gears for a moment to speak briefly about the public health units here in Ontario. Public health units have spent considerable time and resources to effectively support the pandemic response and vaccine rollout. That is why we will continue to support municipalities in dealing with this pandemic. To support the response of COVID-19 and local vaccine efforts, the Ministry of Health has invested $1.4 billion in additional funding for public health units throughout this pandemic. And today, I am pleased to announce that we are providing further stability to municipalities by extending the cost-sharing mitigation funding through 2023 with a provincial investment of approximately $47 million. This funding provides continued support for public health units and municipalities beyond the funding that was approved in previous years, and will ensure you have the financial stability needed to protect communities across Ontario. This will also ensure that you can continue to deliver key services beyond COVID-19 efforts, such as childhood immunizations and public health inspections. Since 2018, provincial funding for public health units to implement public health programs and services has increased by nearly $100 million. And that's not including the COVID-19 related investments. This includes funding to support the Ontario Seniors Dental Care Program, retain nurses across the public health sector, and mitigation funding to ensure municipalities do not experience any cost increase at this critical time. Another way we are supporting this is by continuing to implement Ontario Health Teams. Ontario Health Teams present an opportunity to strengthen the collaboration between health system providers, including municipal partners, for the benefit of all Ontarians. I know many of you have already forged positive relationships with your local Ontario Health Teams, and I am grateful. Thanks to those partnerships, Ontario health teams are making improvements to integrate patient care and have demonstrated remarkable responsiveness to the COVID-19 pandemic. Ontarians should be proud of the progress we have made in a number of critical areas, including our healthcare workforce, emergency departments, long-term care, primary care, and surgeries. This would not be possible without Ontario's healthcare workers, those unwavering committed to ensuring Ontarians continue to receive high-quality care in the right place at the right time. And it would not be possible without the contributions of many healthcare stakeholders, including the many municipal partners in this room today who are helping to build a stronger health system in your community. But we also know that there are no easy solutions to the challenge facing the system now. We have made progress, but we can do more. These challenges require bold and innovative solutions to better integrate patient care for all Ontarians, which is why we will continue to address short-term stressors and continue to invest to build a stronger, more resilient health system that better meets the needs of patients. Many of the pressures currently facing the healthcare system are not new, and none are unique to Ontario. We can no longer stand by and support a status quo that cannot respond to the current challenges the sector is facing. Instead, guided by the best evidence and the successes of other jurisdictions, our government will take bold action that prioritizes patients and their health care above all else. It is what Ontarians deserve, and it is what Ontarians working on the front lines of our health system deserve. We can all continue to work to innovate and improve a healthcare system that works for all Ontarians. Thank you. Merci. Stay well.